Some of the practical things that you can think about are posters in the waiting room and instructions and a request that people wear masks when they're in the waiting room and they have upper respiratory symptoms. You can think about messaging to your patients over time so that they get used to the fact that if they're coming in sick, that they call ahead and just warn you, so that maybe there's some possibility of shifting things around so they don't spend so long in the waiting room. Hand hygiene is, enormously valuable. During SARS in Toronto, we weren't even smart enough to measure its effect. But when you look at the studies that came out of SARS from Southeast Asia, hand hygiene had a really solid protective effect. So it doesn't sound that important, but it's critical. Having alcohol hand rub for your patients to use if they can come in, being careful not to let kids get at it, and having enough alcohol hand rub for you and your staff to be using regularly, really important. Across Canada, there are different case definitions even at the moment, and they're changing as we speak. That's really frustrating for everybody, but it's unfortunately a necessary thing about what happens during outbreaks. And so I think what that means for those of us who are on the front lines is you need to know whatever case definition your public health unit is using now, and that's making sure that you're keeping an eye out for communication with them so that when it changes, you know about it. You need to make sure that if you meet somebody who meets that case definition, you're definitely doing testing. And if for some reason you find somebody and you're worried or they're worried, you should make sure that you know that you have a contact at public health. Just call and say, I know this person doesn't quite meet the case definition, but I'm really worried about it. What do you think? And they'll have been watching really carefully. And if they say no, then you don't have to worry about it anymore. But sometimes they will say yes, because they're also trying to use the testing in the most effective way. This novel coronavirus is a virus that infects the upper and lower respiratory tract. So think of it as something like parainfluenza or human metapneumovirus or respiratory syncytial virus. We don't have vaccines for them. We don't have any specific treatment for them. So when you see somebody with this infection, you're treating them with supportive care just like you treat any other influenza-like illness or upper respiratory tract infection. The first thing to know is that there's a lot of winter respiratory viruses still around. Lots and lots of people who are going to be coming to your office with respiratory tract infections, unless they have risk factors, contact with somebody who's traveled, a travel history. You don't have to worry about them or treat them any differently, although you may have to calm them down and help them understand that they're not at risk. You do, however, need to be clear that patients who are coming to you who are ill know that they need to tell you if they've traveled or if they have a household contact who's traveled. And that means you need to know two things from your local public health unit. The first is, what are the questions you're asking today or this week? And how are you going to know if the public health unit has changed those questions? And the second is, when somebody answers yes to those questions, what are the instructions from public health about what you should do? You're going to have to report them. Public health is there to help get the testing organized and get everything done. So you really need to be clear that when somebody says yes, that you have the pathway, current pathway in your local health unit, or contact at your local health unit. You can call and say, what do I do with this patient now? The most important lessons I think we've learned is about communication and transparency at a global level. This is a virus that, as far as we can tell, was first in a human population at the end of November of 2019. The Chinese detected it and found the outbreak in less than a month. We had the sequence a week after that. We're going to have pretty readily accessible diagnostic tests in a month. Relative to SARS, that's a miracle and a reflection of an enormous amount of work that's done. I think we're doing much better with general training of people in infection control practices. Our hand hygiene's gotten a lot better. We're doing better, I think, with communication within Canada. So there's a very long list of things.